Okay, good day everyone! Welcome aboard to our exploration of the fascinating world of tooth eruption, a process that plays a crucial role in dental health, especially in our younger patients. Tooth eruption isn't just about teeth breaking through the gums. It's a dynamic, ongoing process that begins well before a tooth ever becomes visible and continues throughout its life. We'll delve into the phases of tooth eruption, starting from the pre-eruptive phase where the tooth moves within the jawbone to the eruptive phase where it makes its grand entrance into the oral cavity. And finally, the post-eruptive phase where it adjusts to maintain its position and function. We'll also explore the various theories that explain how teeth move, from the root formation theory to the periodontal ligament traction theory. Each idea gives us a different perspective on this complex process. Understanding these mechanisms not only enhances our knowledge, but also equips us to handle the challenges and anomalies that might arise, such as delayed or premature eruptions. So, let us dive in together, unraveling the journey of the tooth from its earliest formation to its final position in the mouth. Whether you're a student, a seasoned professional, or just curious about the science behind that perfect smile, there's something here for everyone. Thank you, and let's get started.
In bringing this report to life, each member of our team played a crucial role in this project. Allow me to introduce the minds behind this work. We have Comilla Francesca Jolene, yours truly Higit Pauline Kate C, Librojo Kylie Sofia D, Peñaflor John Romiel S, and Villasana Florence T. Our objectives today are very clear. We aim to explain the intricate mechanisms of tooth eruption, which is very significant in dealing with child patients. Second is to recall the stages and phases of the tooth eruption. And lastly, to connect the mechanisms of tooth eruption in clinical situations.
Hi everyone, I'm Florence, and before we delve to our main topic, which is the mechanism of tooth eruption, let's recall first some of the knowledge we've learned in our oral anatomy class. Let's tackle first the phases of tooth eruption. Now let's tackle the first phase, which is the pre-eruptive phase. This begins during tooth development within the jawbone. In this phase, the tooth moves within the bone as the jaw grows. This phase involves significant changes in the position of the developing teeth as they are pushed towards their final position. Imagine the teeth as seeds growing underground. As the ground or the jawbone expands, these seeds are slowly moving around, getting ready to sprout and come to the surface. Next is the eruptive or pre-functional phase. This begins once the crown of the tooth is fully formed. In this phase, the tooth starts to move towards the oral cavity. This phase involves the tooth breaking through the bone, moving through the gum tissue, and eventually becoming visible in the mouth. There are three key events in this phase. First is the tooth breaks through the gum or the gingiva, it emerges into the mouth, and the tooth moves into its proper position to align with the opposing teeth. This phase is like a plant breaking through the soil and finally sprouting above the ground. The tooth pushes through the gum, just like a plant pushes through the earth, and it starts to settle into its place in the mouth. The last phase, which is the post-eruptive or functional phase, begins after the tooth reaches the level where it meets the opposing tooth, or the occlusal plane. Once the tooth is in place, the tooth continues to adjust its position to maintain proper alignment and function within the mouth. This phase lasts for the rest of the tooth's life. Key events during this phase are first, adjusting to jaw growth, second, compensating for tooth wear by moving slightly, and lastly, making minor adjustments to stay in proper contact with neighboring and opposing teeth. Think of this phase as the plant that has fully grown and now needs to stay upright and healthy. The tooth, like the plant, makes small movements and adjustments over time to keep its place and function well, even as the surrounding environment changes.
Here are the eruptive characteristics. We have first the timing, where in the primary dentition, the eruption begins around 6 months of age and is typically completed by 2 to 3 years. And for the permanent dentition, the eruption starts around 6 years of age, usually beginning with the first molars and the lower central incisors. Next is the sequence, the order of eruption. The teeth usually erupt in a specific sequence. For primary teeth, the sequence is central incisors, lateral incisors, first molars, canines, and second molars. For the permanent teeth, the first molar erupt first, followed by the central incisors, lateral incisors, canines, premolars, and then second molars. Teeth generally erupt symmetrically on both sides of the mouth. For example, if a tooth on the left side erupts, its counterpart on the right side usually erupts at about the same time. Next is the eruption pathway. Teeth move through the bone and gingival tissue along in a specific pathway. This movement involves the resorption of the bone and soft tissues that cover the tooth. Eruption can be influenced by genetic factors, nutritional status, and systemic health conditions. Delays in eruptions may be associated with endocrine disorders or nutritional deficiencies. Next, for the clinical signs and symptoms during the eruption, it may include gum swelling, drooling, and irritability. Eruption cysts or the fluid-filled sacs over the eruption tooth may also be observed. And lastly, the eruption anomalies. Anomalies such as delayed eruption, premature eruption, and impaction when a tooth fails to emerge fully are common concerns. This can result from genetic factors, local obstacles, or systemic conditions.
Get ready to explore the amazing journey of how our teeth come to life from just a few cells into the shining pearls we use every day. Let's break down the 6 exciting stages of tooth development. The first stage is the thickening stage. Imagine the oral epithelium as a bustling construction site. The thickening stage kicks off this process, where certain areas of the future dental arches start to thicken. This thickening forms a dental lamina, a horseshoe-shaped bond that lays the groundwork for tooth buds. These thickened spots are where our future teeth will grow. It's the blueprint phase, setting up the foundation for everything that follows. And the second stage is bud stage. Welcome to the bud stage, where things start to take shape. The dental lamina divides into the underlying tissue, forming small, rounded tooth buds. Think of these buds as the early versions of our future teeth. Surrounding cells start preparing for the big job ahead. It's a crucial time as these buds will soon begin to develop into individual teeth. Now, the tooth buds take on a cup-like appearance, and this is the cup stage. Here, the buds start to differentiate into 3 key parts: the enamel organ, the dental papilla, and the dental follicle. Each part has a vital role. The enamel organ makes enamel, and the dental papilla creates dentine and pulp, and the dental follicle supports everything. This stage shapes the basic form of the future tooth, setting the stage for more detailed development. Enter the bell stage, where the tooth gets its final touches. The enamel organ now has 4 layers, each playing a unique role in forming the tooth's crown. The dental papilla starts creating dentine with the help of odontoblast, and the shape of the tooth becomes more defined and the structure matures. It's like fine-tuning the final design of a masterpiece. Here comes the secretory stage, where the real magic happens. specialized cells known as ameloblasts start producing enamel, while odontoblasts lay down the dentine. This stage is all about depositing these mineralized tissues, which give our teeth their strength and function. It's where the tooth truly becomes hard and ready for action. Finally, we reach the eruption stage, the grand debut of our teeth. The developing tooth makes its journey from within the jawbone to its final position in the mouth. This process involves breaking through the gum line and aligning correctly in the dental arches. Proper eruption is crucial for a perfect bite and overall oral health, ensuring our teeth fit together just right. And there you have it, the incredible journey from tooth development to eruption. Each stage plays a crucial role in making sure our teeth come in perfectly. Next time you brush your teeth, remember this amazing process that makes those pearly whites possible. Hey everyone, let's get excited as we dive into the fascinating factors that influence tooth eruption. Buckle up because we're about to explore what makes our teeth pop up and shine. First is genetic factor. Ever wondered why some people get their teeth earlier or later than others? That's because genes are the VIPs in this process. The timing and pattern of tooth eruption are largely dictated by the genes we inherit from our parents. If your family has a history of early or delayed tooth eruption, it's all in the genes. Next is gender. Here's a cool fact. Girls generally experience tooth eruption earlier than boys, and that's right. Females tend to grow and develop a bit faster, which extends to their teeth coming in sooner. Hormonal differences between genders might also have a say in when those teeth make their big debut. Next is socioeconomic factors. Your socioeconomic status can make a big difference. Kids from families with higher socioeconomic status often get better nutrition and dental care, leading to smoother eruption patterns. On the flip side, those from lower socioeconomic backgrounds might face delays due to less access to care or nutrition. Next is birth weight. Birth weight is another exciting factor. Babies born with low birth weight might see their teeth coming in a bit later. This is because lower birth weight can slow overall growth and development. On the other hand, normal or high birth weight usually aligns with typical eruption timelines. Next is hormones and vitamins. Hormones like growth hormone and thyroid hormone are like the directors of the tooth eruption show. Plus, vitamins, especially vitamin D and calcium, are essential for healthy tooth development. If these hormones or vitamins are out of balance, it can mess with the timing and sequence of tooth eruption. Next is race. Did you know that race can influence when teeth erupt? For example, studies show that African children might see their teeth come in earlier compared to Caucasian children. These differences are often due to the unique genetic factors found in different populations. Finally, let's talk about local and systemic factors. The amount of space in your jaw and the condition of your gum tissue can directly affect how your teeth erupt. Systemic factors like overall health and nutrition also play a big role. Conditions like malnutrition or diseases such as hypothyroidism can lead to delays or unusual eruption patterns.
Next is the age of eruption. So review lang to ng oral anatomy natin before. This table shows the age of eruption of permanent teeth. The sequence of tooth eruption in permanent teeth. For maxillary, the first one to erupt is the first molar, second is the central incisor, next lateral incisor, followed by first premolar, then second premolar, canine, second molar, and lastly, third molar. For mandibular, the first one to erupt is the central incisor and first molar. Second is the lateral incisor, third is the canine, next is first premolar, then second premolar, second molar, and lastly, third molar.
Hello everyone! Now, let's take a look at the mechanism of tooth movement or the theories of eruption. First, we're going to tackle about the root formation theory, where it suggests that a tooth erupts because its growing roots pushes it upwards. This movement happens as the root lengthens and needs more space. Some believe there is a strong base like a cushion hammock at the bottom of the tooth socket to help this push. Let me show you a video to better explain what this theory is about. So, root formation theory suggests that as the root of a tooth grows, the lengthening root exerts a force, increasing length of root during its formation, and can be accommodated either by an occlusal movement of the tooth or by resorption of the bone at the base of the socket. So this force could potentially push the tooth upward or occlusal direction, so it erupts into the mouth. For this movement to happen, there needs to be a stable base at the bottom of the tooth socket to counteract the force. So some researchers propose that a structure called the cushion hammock ligament acts like a sling, providing the stable base needed to translate the root's downward growth into upward tooth movement. However, when examining developing tooth structures under a microscope, no such cushion hammock ligament has been found. Instead, they observe only a membrane around the dental pulp, which doesn't attach to bone and therefore can serve as a fixed base to support this theory. There are challenges to this theory, such as teeth sometimes move farther than the length of their roots. Some teeth end up moving a greater distance during eruption than the actual length of their roots. This observation suggests that something other than just root growth is contributing to the tooth's ability to move through the gum and into the proper position in the mouth. Second challenge to this theory is that teeth continue to erupt even after the root is fully formed. Even after a tooth's roots have fully developed, teeth often continue to move upwards or erupt. If root growth were the only factor driving tooth eruption, we would expect to stop moving once the roots are complete. But this isn't the case. For the last challenge to this theory is that teeth can still erupt even if their roots are removed. In experimental situations where the roots of developing teeth are removed, the teeth still manage to erupt. This finding indicates that the presence of roots is not as critical to the eruption process as once believed, suggesting that other forces or mechanisms must be at play.
Good day everyone! Today we'll be exploring the fascinating process of tooth eruption, specifically focusing on the bone remodeling theory. This theory delves into how the dynamic changes in bone structure through the activities of cells like osteoclasts and osteoblasts play a crucial role in guiding teeth as they emerge into their proper position. We'll discuss the key mechanism involved, the role of surrounding tissues, and the ongoing scientific debate about whether bone remodeling drives tooth movement or is a response to it. So first, what is bone remodeling theory? This theory proposes that the eruption of tooth is brought about by selective deposition and resorption of bone that occur around the developing tooth. According to this theory, the resorption of bone in front and deposition of bone behind the erupting tooth results in tooth movement. Nakakalito, di ba? Ang hirap intindihin. So for easier understanding, there are some experimental studies have shown supporting evidences for this theory.
Hello everyone! In this video, I'm going to illustrate the 3 experimental studies that support the evidence for this theory. In experiment 1, let's say if we are removing the tooth germ and the dental follicle was left behind, still the eruption pathway was created. In experiment 2, we removed the tooth, and when a silica replica was placed after removal of developing tooth, it erupted normally like a tooth. In experiment 3, when the dental follicle was removed but the tooth has not been removed, no eruptive movement will be created in this case. In conclusion, these all experiments are suggested that the power of tooth eruption is not in the tooth but in the dental follicle on the surrounding bone.
So after watching the video, we can say that the main power of tooth eruption is the osteoblast and osteoclast, which develop from dental follicle. The dental follicle may aid by supplying blood vessels that bring osteoclasts to the area, while osteoblasts help by secreting enzymes that make bone easier to break down. These bone changes are crucial for the tooth to move into position, though it's debated whether bone remodeling causes or results from tooth movement. Additionally, growth of the alveolar bone and the action of the periodontal ligament may also help in positioning the tooth. Multiple factors are at play and the exact mechanisms are still being studied.
Now let's get to the third theory, which is the vascular pressure or hydrostatic pressure theory. According to this theory, the local increase in tissue fluid pressure in the periapical region of the tooth causes the occlusal movement of the tooth. This theory proposes that the periapical tissue surrounding the tip of the developing tooth root contains many blood vessels. Active fluid movement from these vessels into the surrounding tissue can cause the tissue to swell by about 50%. Because the periapical tissue is confined within a closed space, this swelling leads to a local increase in pressure. This pressure is then exerted into the tooth, pushing it upwards toward the mouth. However, since this pressure difference is temporary, there is doubt as to whether this factor alone is enough to drive the entire tooth eruption process. Every theory has its doubt or challenges, and for this theory, critics of this theory argue that hydrostatic pressure might not be sufficient to sustain the long-term movement required for tooth eruption, while there is evidence that reduced blood flow to the periapical region can slow down eruption. This might also affect other factors such as tissue growth, which could be responsible for the observed decrease in eruption rate. Despite the challenges, some experiments support the role of vascular pressure in tooth eruption. First is the increased pressure. When hydrostatic pressure was increased using hypotensive drugs, the rate of eruption increased. While reduced blood flow when sympathetic nerves were stimulated to narrow blood vessels, which causes vasoconstriction, the rate of eruption decreased. This finding suggests that vascular pressure does play a role, even if it might not be the sole cause of the tooth eruption. For you to understand it more clearly, the vascular pressure theory suggests that the pressure from blood vessels at the tip of the developing tooth root helps push the tooth out into the mouth. However, some people doubt that this pressure alone is strong enough to keep the tooth moving up for a long time. Supporters of this theory have done experiments showing that if you increase blood pressure in the area, the tooth erupts faster. But if you reduce blood flow by narrowing the blood vessels, the tooth erupts more slowly. So while blood pressure does play a role in helping the tooth emerge, there's still debate about whether it's the main reason teeth erupt.
Hey mga kabagang! Let us now move on to the next theory. Do you have an idea about it? Yes, you're right! It's about the pulp. Oh, hindi yun nakukuha sa prutas ha? Ito! Let us now dive into the intricate landscape of the pulp growth theory.
At this stage of our course, we understand that the dental pulp originates from the neural crest cells in the fetus, which gather to create the dental patella. In its mature form, the pulp is surrounded by a layer of specialized cells known as the odontoblasts. Additionally, the dental pulp is richly supplied with blood vessels and nerves around it. But have you ever wondered how the pulp actually grows? Let me introduce you a theory about it. Once upon a time, an idea about how teeth push through the gums is that the growth of the pulp or the soft tissue inside the tooth helps to create the force needed for the tooth to move up. A researcher named Sitcher suggested this idea. People who supported this theory think that at the end of a developing tooth's root, the cells are actively dividing and making the pulp grow, which might help the tooth erupt or come in. And did you know? Some experiments have shown that when certain drugs that stop cell division, called antimitotic drugs, are used, the rate at which teeth erupt slow down. Pumabagal. Kung kaya naman, ito ay nangangahulugan na ang paglaki ng pulp ay importante para sa tooth eruption. However, this isn't enough evidence to prove that pulp growth alone is responsible because those drugs might also affecting other parts of the body that are important for tooth eruption. So, while this idea that pulp growth helps the teeth erupt is interesting, it's not fully confirmed yet.
Andyan pa ba kayo mga kabagang? Meron pa akong isang theory, and it's about the constriction of the pulp.
So, in the constriction of the pulp theory, as the tooth develops, the root continues to grow, and the material that makes up the root, called dentine, and it gets thicker. This thickening of the dentine makes the space inside the tooth where the pulp is located smaller. Lumiliit siya, diba? Pansin niyo dito, lumiliit. And some people believe that the pressure caused by this shrinking space is enough to push the tooth out through the gums, which is what we called the tooth eruption. However, this isn't fully supported by scientific experiments. One reason is that some teeth without pulp, called pulpless, can still erupt, meaning they move into their correct position in the mouth even without this pressure. Also, if a baby molar tooth is taken out early, the adult tooth that replaces it can still come in without the growth of dentine or the pulp getting squeezed. Because this points, most experts don't accept the theory that pressure from the shrinking pulp is the main cause of tooth eruption.
Now, let's move on to the periodontal ligament traction theory, where it explains that tooth eruption is driven by the contraction of fibroblast cells in the periodontal ligament, which pull the tooth into place. The process is likened to sailors pulling on a rope to move a sail, with the fibroblasts creating the necessary force to guide the tooth's movement. Fibroblasts are cells that can contract or pull, and they use this ability to exert force on their surroundings. They transmit this force to the collagen fibers in their environment. The collagen fibers are connected to each other and work together to help move the tooth. Think of it like this. Imagine fibroblasts as sailors pulling on a rope made of collagen. This rope is attached to a sail, which represents the tooth. According to the theory, the process of tooth eruption happens because the fibroblasts create a pulling force that is transmitted through the collagen fibers. This force helps move the tooth into its proper position. For this system to work properly, the collagen fibers need to be aligned correctly. If there's any problem with their alignment, it can prevent the tooth from erupting correctly. There are several experiments that support this theory. First is when scientists damage the periodontal ligament, tooth eruption slowed down or stopped, showing how important this ligament is for tooth movement. Second, fibroblasts, when placed on a flexible surface, were observed to create wrinkles as they moved, showing that they can generate pulling forces. Lastly, experiments with animals showed that teeth could still move even when other factors like root growth were removed, indicating that the ligament's pulling force is enough to cause eruption.
Hey everyone! Today, let's dive into the fascinating world of the dental follicle theory, a key player in how our teeth make their grand entrance. First, what is the dental follicle? The dental follicle is like a tiny bug that wraps around your baby tooth while it's still growing inside your jaw. This little sac is essential because it helps the tooth get ready to break through the gums and make its debut. It's not just a protective covering, it's crucial for the development of important structures around the tooth. But how does it help teeth erupt? The dental follicle is like a backstage crew for your tooth's big performance. It creates a path for the tooth by signaling the body to remove some of the bone that's in the way, allowing the tooth to push its way up and emerge into your mouth. This process ensures that the tooth can come through the gums smoothly and without obstruction. Why is it important? Not only does the dental follicle help the tooth erupt, but it also plays a crucial role in forming the ligaments and bone that hold the tooth securely in the place once it's out. If the dental follicle doesn't function properly, it can lead to problems like delayed tooth eruption or teeth that never emerge at all. This makes the follicle essential for both the eruption process and the long-term stability of the tooth. So for dentists, understanding the dental follicle is crucial, especially when dealing with impacted teeth, those that don't come out as they should. If a tooth is stuck and the follicle is unusually large, the dentist might need to remove both the tooth and the follicle and send the tissue for testing to ensure there's no underlying issue. In younger people, having a larger follicle is typically normal. But if you are older and still have a large follicle around an impacted tooth, it could be a cause for concern. Your dentist may suggest a biopsy to rule out any potential problems. But what is the connection between dental follicles and osteoblasts? The connection between the dental follicle and osteoblasts is important in understanding how teeth develop and emerge through the gums. But first, what are osteoblasts? Osteoblasts are specialized cells responsible for creating new bones. They play a key role in bone formation, including the alveolar bone, which is the part of the jawbone that holds teeth in place, and how the dental follicle interacts with osteoblasts. During tooth eruption process, as the tooth develops, the dental follicle sends signals that influence the behavior of osteoblasts in the surrounding bone. And second is bone formation. While some cells in the dental follicle help resorb or break down bone to create a path for the tooth to erupt, others help stimulate osteoblasts to build new bone around the tooth as it moves into place. The third is periodontal development. The dental follicle contributes to the formation of the periodontal ligament and alveolar bone, both of which involve the activity of osteoblasts. The follicle provides signals that encourage osteoblasts to produce the bone that will eventually support the tooth. And in summary, the dental follicle doesn't just help teeth break through the gums, it also guides osteoblasts in building the bone needed to support the teeth. This interaction is crucial for both the proper eruption of teeth and the development of the structures that keep them securely in place.
First on the list is the premature eruption. It is where tooth erupts into the oral cavity much earlier than normal time of eruption. Frequently involved teeth are deciduous mandibular central incisors. The term natal teeth is used when the deciduous teeth are present at the time of birth. Deciduous teeth which erupt within the first 30 days of life are termed as neonatal teeth. Premature loss of deciduous teeth causes premature eruption of permanent teeth, which may be related to hormonal disturbances.
One of the clinical conditions where the eruption process is being disturbed is because of delayed eruption. Tooth erupts into oral cavity much later than the normal time of eruption. Both deciduous and permanent dentition may be affected. So this condition occurs when a tooth erupts into the oral cavity later than the typical time frame for its eruption. This delay can affect both the primary and permanent dentitions. Factors contributing to delayed eruption include local factors like space issues, systemic conditions such as hypothyroidism or nutritional deficiencies, and genetic influences. Clinically, delayed eruption might necessitate radiographic evaluation to determine the position and development of the unerupted tooth and to rule out any underlying pathology.
So now the impacted teeth. Impacted teeth are like stubborn kids who just won't come out to play because something's blocking their way. This happens when teeth, especially those tricky wisdom teeth at the back, can't erupt properly due to not enough space or physical barriers. They might get stuck and cause all sorts of trouble like pain, swelling, or infections. Sometimes they even push on other teeth or cause cysts and tumors. The usual fix? Surgical extraction to clear the way and prevent any more headaches.
Next clinical condition that disrupts the eruption process is the embedded teeth. It refers to those teeth that are unerupted due to lack of eruptive forces. Embedded teeth are those that remain unerupted because they lack sufficient eruptive forces to push them through the gum tissue and into the oral cavity. Unlike impacted teeth, which are obstructed by physical barriers like another tooth or bone, embedded teeth are typically affected by a failure in the eruptive mechanism itself. This condition can result from systemic factors such as endocrine disorders or local factors like an abnormal path of eruption. Embedded teeth may require interventions such as surgical exposure or orthodontic assistance to guide the tooth into proper alignment within the dental arch.
Now let's talk about ectopia. When a tooth decides to have its own party in the wrong spot, this happens when the tooth erupts somewhere it's not supposed to, like a maxillary canine popping into the nasal cavity or a mandibular third molar coming through your cheek. It can mess with your bite, chewing, and even make you self-conscious about your smile. Managing ectopic teeth is no small feat. It often takes a team of experts to remove or reposition the tooth and get everything back on track. The key is spotting it early and jumping in with treatment to avoid further issues.
Tooth transposition is a dental condition where two teeth swap their usual position within the mouth. A common example is the exchange of position between maxillary canine and the premolar. This condition can affect the alignment and function of teeth, making it a significant consideration in orthodontic treatment and overall dental care.
Tooth rotation is a developmental anomaly where a tooth turns from its normal position in the mouth. This rotation can be partial, where the tooth is slightly turned, or complete, where the tooth is fully rotated, changing its orientation in the dental arch. This condition can affect the appearance and function of the teeth and may require orthodontic treatment to correct.
Patient education regarding tooth eruption is crucial, especially for guiding parents. Educating them about the eruption process helps them understand the significance of maintaining their child's oral health, recognize potential issues early, and seek timely dental care. This proactive approach can prevent complication and ensure proper dental development.
Understanding the timing of tooth eruption is crucial in dental practice for two main reasons. First, for the monitoring development, where dentists rely on a normal timeline of tooth eruption to track a child's dental growth by comparing a child's eruption pattern to expected milestones. Dentists can identify potential issues early. For instance, if teeth erupt too early or too late, it might signal underlying health concerns or developmental disorders that need further investigation. Second reason is the intervention. In cases where a tooth fails to erupt as expected, timely interventions may be necessary. This could involve procedure like surgical exposure to help the tooth emerge or orthodontic treatments to guide it into proper alignment. Addressing these issues promptly ensures better oral health outcomes and prevents more complicated problems down the line.
Orthodontic treatment plays a vital role in managing tooth eruption. Proper eruption is essential for the correct alignment and spacing of teeth. If teeth erupt improperly, it can lead to misalignment or crowding, often requiring orthodontic interventions like braces or aligners. Dentists may also guide the eruption process to prevent malocclusion by removing primary teeth at the appropriate time or by using tools like space maintainers.
Let's jump into a crucial topic in dentistry that's both fascinating and super important. Impacted teeth diagnosis and treatment. Imagine your teeth trying to emerge but they're stuck. Impacted teeth are just that. These teeth can make their grand entrance into your mouth because there's either not enough space or something's blocking their way. Wisdom teeth are the usual suspects, but canines and other teeth can get stuck too. These can lead to serious issues like pain, swelling, infections, and even damage to nearby teeth. To figure out what's going on, dentists use cool tools like x-rays to see exactly where the tooth is and what's causing the blockage. The solution? Often it's a surgical extraction to get the tooth out and prevent future problems. After surgery, managing pain and avoiding infection is key to getting back to your smile's best.
One of the clinical significance of this topic, which is the mechanism of tooth eruption, is identifying abnormalities. Abnormalities like supernumerary teeth or ectopic eruption can be identified early through an understanding of the eruption process. This allows for timely treatment. By understanding the normal tooth eruption process, dental professionals can identify these anomalies early. Early detection is crucial because it allows for prompt treatment, which can prevent or minimize complications such as malocclusion, impaction, or damage to an adjacent tooth. For instance, an early diagnosis of a supernumerary teeth might involve removing it before it interferes with the eruption of permanent teeth, while ectopic eruption might require orthodontic interventions to guide the tooth into its correct position. This proactive approach helps maintain proper oral function and aesthetics, reducing the need for more complex treatments later on.
In pediatric dentistry, the process of tooth eruption is vital for a child's dental development. Primary or baby teeth need to fall out naturally to create space for permanent teeth. Dentists closely monitor this process to ensure it happens correctly. If there are problems like delayed eruption or the presence of eruption cysts, early intervention is important to prevent future dental complications.